Welcome to the eClinicalWorks podcast. I'm your host, Brian Hughes. These are unprecedented times, and health centers have and continue to be at the forefront of the epidemic, from testing members in their community to continuing to serve the underserved and adopting new ways of protecting their patients and their staff. In the spirit of Health Center Week, with me today is Ashley Clement, who is the Quality Assurance and Improvement Coordinator for Southeast Community Health Systems, which is a 32-provider FQHC providing medical, dental, and behavioral health services, which include mental health counseling, substance abuse treatment, OBGYN, and podiatry services. They are located in Zachary, Louisiana, and throughout Southeast Louisiana. Ashley, thank you for joining our podcast today.
You're welcome, Brian. Thank you and eClinicalWorks for allowing me this opportunity.
We'll start with some questions here. Southeast Community Health System went live with eClinicalWorks in December 2019, so a fairly new customer. 4 months later, a global pandemic hit the world. And would you be able to tell us a little bit about your go-live process in December and how your practice adapted when the pandemic hit?
Yes, certainly. So as you can imagine, it was a crazy time for us. We were previously using Greenway Health Success EHS. And so going live in December, as you mentioned, we went live on December 9th. It was a mid-holiday season, so we had a lot of staff out. It was also the end of the year, so we were gathering data, starting to validate our data for end of the year reporting requirements. And so by the time we finally kind of got through all that and were able to breathe, and just in the midst of learning a new electronic health record system and trying to begin to develop our workflows within eClinicalWorks, the COVID-19 pandemic hit. As I mentioned, we had begun to implement numerous interface projects with eClinicalWorks, but those all had to be put on hold due to the coronavirus pandemic. And so we had to quickly shift our focus and priority to implementing telehealth. Needless to say, we were able to conduct our first televisit by the end of March.
So it sounds like a great team you had formulated there to really take on the coronavirus and continue servicing your patients. How has your health center, during this crisis, what kind of role did technology play? I know you mentioned a few, but how are you able to communicate with your patients to still provide services? You mentioned telehealth. Would you be able to expand a little more on it?
So we started behavioral health TeleVisits with another platform, actually, that we had an agreement with. So we switched the behavioral health providers to eClinicalWorks healow, and then brought on our medical providers. And not long afterwards, we incorporated our dental providers into telehealth. And so initially, telehealth comprised about 75% of all of our visits. And today, it's about 35 to 40%.
How did you, as an organization, reach out to your community to let them know that you're still providing care, and anyone who's seeking care, should reach out to Southeast Community Health System?
So our providers reviewed their schedules. So they looked at their current and future schedules, starting back in mid-March, and they reached out to those patients personally, or had their nurses reach out to see and to kind of talk to them and screen them to see if some of those patients would be more suitable for a telehealth visit. We also updated our website, Southeast Community Health System's website, with information and consent forms for all three of our telehealth services, so telemedicine, telebehavioral health, and teledentistry. We mailed postcards. We have school-based health centers too, and some of those students had consent forms on file for us to be able to treat them during the school year. And so we mailed postcards, little colorful, bright, quick informational postcards to their homes. We also posted a lot of information on social media, including LinkedIn, Twitter, and Facebook. And we produced local news commercials, which were a big hit. And we sent emails through the eClinicalWorks Messenger.
As an organization, how were you able to identify those patients in your community that needed to be contacted because there was, a gap in care?
One is that we use the eClinicalWorks registry, which can be configured for certain patient demographics, labs, procedures. You can configure it by CPT code, ICD code. And then once you set the options, you create your message to that specific patient population.
Speaking about telehealth, how did your community of patients respond to your outreach and also to the telehealth service?
So eClinicalWorks produces a little YouTube video. I believe it's about 3 minutes, and it's called How to Get Your Patients Started with Healow TeleVisits. And we also placed it on our website. And then there's also a one-page flyer that eClinicalWorks makes, and it says, what is a televisit? And so we provided that flyer to our patients, our front desk staff, our nurses. They all had those sources of information. We had also developed a little 5-question brief survey for telehealth, specifically for telehealth. And that goes out to each of the patients after their visit. And that was done through the eCW Messenger campaign. And so the results from that survey show us how much the patients really like the telehealth platform. They also appreciated that a nurse contacts them ahead of their appointment to ensure they understand how to use the technology. They would provide instructions on the different telehealth modalities, like that they could do it through their text message, through the healow app, through the patient portal, just whatever works for them.
How did your staff adjust to offering telehealth services?
So our staff adjusted surprisingly very well. And I believe that starts with leadership, accessibility, collaboration, support, and transparency. And just knowing that we had designated personnel assigned to assist with troubleshooting allowed the providers reassurance for a successful patient-provider experience. We also, though, developed both written and schematic workflows for each of the clinics. So for behavioral health, dental, and medicine. We also referred them to the my.eclinicalworks.com customer support portal, and where they have a dedicated health center tab. They also have that notifications tab, which has a plethora of information related to all things COVID and telehealth. Lastly, we use the eCW University training videos, and you can assign those to staff as needed. eClinicalWorks allows us to care for patients in a remote location during the pandemic by implementing virtual visits. Technology allows us access to our patients while maintaining safety, especially for the high-risk patients, and they're able to see their provider from the comfort and safety of their own home or really wherever they choose.
How does eClinicalWorks help you analyze how you use telehealth operationally and with analytics and reporting?
So we use healow analytics for telehealth, and it shows all kinds of data. And some examples, or it will show you the usage of patients and the modalities that they're using to connect to the telehealth visits, like healow app, the patient portal data. It also has Messenger, so it shows you your campaigns or messages being sent to and from the patients. And then we also use the EBO report, particularly 13.07. It's the visit count report, and that's run by various methods to analyze some of the following data. So we look at it for our weekly reporting that we have to do for the HRSA COVID-19 survey on number and percentage of telehealth visits compared to total visits. We also use it for monthly tracking and reporting of no-show percentages for virtual appointments compared to clinic appointments. And we use it to track our audio visits and to validate those for billing and documentation compliance.
Would you be able to share any lessons that you learned in adapting to this global pandemic?
Be willing to start. If you fail, that's okay. Just reassess what went wrong, what worked, and capitalize on your strengths and improve the weaknesses.
Now, as a health center, how do you and your organization envision the near future and also the distant future and how you deliver care in your community?
So really our future goals that we've discussed as a leadership team would include definitely sustaining our telehealth operations. And we may add features as they become available, such as the recent contactless check-in. We're excited about learning more about that. We do anticipate a continued increase in behavioral health services, just given the pandemic and increased anxiety and depression within the community at large. We also want to formally adapt a process and workflow for collecting social determinants of health And I guess I would wrap up by saying that our future operations include remote patient monitoring devices to assist with more monitoring, tracking, and efficient care for those patients with chronic conditions.
That's some great information that you share with us.
Well, thank you, Brian.
And thank you, Ashley, for joining our podcast today.
Absolutely. I was happy to be here.
And thank you, the listener, for joining our podcast. You can find more podcasts like these on iTunes, YouTube, as well as on my.eClinicalWorks or on our website at eClinicalWorks.com. On behalf of the podcast team, thank you for joining today.